Hi, I'm Maddie Sims, and I am a speech language pathologist here at Lanning Healthcare.
I'm Tricia Wiesman, also a speech language pathologist here at Lanning.
And we are here to talk about May, which is our Better Language, Speech, and Hearing Month. And for May, we always like to provide a lot of awareness about the communication disorders that we treat and how speech language pathologists treat them.
Yes, and along with that also we work with swallowing and voice as well, but we'll go into a little bit more detail about those. When it comes to communication, we're not only just treating speech and language disorders, and that can be from ages birth all the way up through adult, but we're also looking at cognition, changes in cognition over time. We use a lot of different comprehensive approaches to address personal needs in regards to all of those areas and adapt programs to benefit the individual. We work with the individual themselves as a patient, but then also with their family or caregiver to enhance those skills at home to better their functional environment.
And not only do we work with the patient and their caregivers, but we also collaborate with occupational therapy and physical therapy. And just like Tricia said, not only are we just speech and language pathologists, we're voice therapists, we're swallowing therapists, we're feeding therapists, we're cognitive therapists. So we treat a wide variety of disorders. And some of those disorders include stroke. May is also National Stroke Month, so a national awareness month for stroke, and we treat multiple different types of strokes, variety of disorders, language, cognition, things like that. We also treat patients with Parkinson's. We do have therapists certified in LSVT loud. We also treat multiple sclerosis, those with ALS. Just a wide variety of disorders.
In regards to swallowing, and voice as well is included in this, we treat all different aspects of the swallowing disorder as well as feeding. So in regards to feeding, that would be more maybe our birth up through adolescence. We have a therapist trained in myofunctional therapy, which is a special technique to help with the development of oral motor skills. That is Brooke West. And then our other areas that we treat with that involve strengthening the muscle to help coordinate for better swallowing function. And we do that through many different modalities that we utilize. Just to name a couple, it's just vital stim. We do IOP feedback, but all of those are meant to give us feedback as well as the patient on how they're doing swallowing so they can continue to enhance their skills and increase the safety of their swallow or feeding. Some of those techniques also carry over into voice therapy, that we utilize those tools to help strengthen muscles for voice, and that could be due to any injury. It could be head and neck cancer, it could be a paralyzed vocal cord, maybe even those that are in sports or cheerleading. Sometimes they develop nodules and things, so we work with those types of individuals to reduce stress on the vocal cords. But really, overall, it's a very comprehensive program that we create. Again, very individualized based on the person's needs.
Yes, and from all of this comprehensive assessment and treatment, we go from all the way from the NICU. So we have therapists in the NICU, and then all the way until geriatric, adult geriatric. So with all these treatment modalities that we provide, we always try to make sure that we are up to date with the most evidence-based research and treatment that we can provide our patients. We are very comparable to those hospitals and outpatient centers in Lincoln and Omaha. So we try to be competitive with them so we can keep our patients closer to us.
Mm-hmm. And we do collaborate with them as well if they've been referred here so that we can carry out what their suggestions are as well when it comes to their treatment. But if you have any questions or concerns or interest in what we do, please feel free to visit our Lanning website and look up speech therapy, or you can give us a call out at our outpatient clinic, which is 402-461-5256, and we'll be happy to visit with you.
Thank you.